Okay, am I on? Can you hear me?
Do it again.
Yes, we're ready.
Okay, you got me?
There you go.
Okay, thank you. All right, this is your moment to shine, Mr. Pratt. Certify the agenda.
Good evening, board members. Chris Pratt with the County Attorney's Office. All of the items on the agenda for this evening have been reviewed by the County Attorney's Office and meet legal approval.
Thank you. Are there any member disclosures for any items on the agenda?
I have none, thank you.
I have none.
No disclosures.
Thank you. So let's move into the consent agenda, review and approve minutes. Has everybody had an opportunity to look at the minutes from our June meeting?
Yes.
I did, Mr. President. I have given the clerk a spelling error to be corrected, but that was the only error I found.
Okay. Okay. Has everybody reviewed the financial reports through August 31st, 2024?
Yes.
Yes.
Okay. And same question with respect to the Finance Committee minutes and actions from July 18th, 2024.
Yes.
Yes.
Great. Now, in this consent agenda, I don't need to, I'm sorry, it's been a couple of meetings. I don't recall. I don't need to move these, do I? Okay,
We do not.
great. So let's move on to our regular agenda. Oh,
You need to vote on them.
I'll make a
My
motion.
apologies. No discussion is required.
Oh, okay.
Among the group, but there is a motion to approve
Oh.
all of the consent items.
thank you. Thank you for correcting me. I would accept a motion to move all of the consent items.
I have a motion to approve all items A through C of the consent agenda.
Second.
All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Okay, let's move on to the regular agenda. Director Hill, would you please provide your report?
Okay, is this thing on? All right. Got a pale light on this one. So I'm going to try and even more succinctly synopsize my report because I think there's more discussion coming on the agenda and I don't want us to be here till midnight. Or I personally don't want to be here till midnight at least. So still participating in a lot of things with a lot of people. Working closely with two of the two Advent Health hospitals in the county to do a new community health assessment and community health improvement plan. It's going to slightly change our schedule, but it puts us in sync with them. And the advantage there is, A, we share cost with them for this process, and B, we're bothering people for the same information. So this way, three of us are bothering them at the same time instead of two hospitals doing it and us. And we're hoping that someday the other hospitals will want to join into this party and we can do a really outstanding job once every 3 years instead of this hodgepodge of outreach that goes on right now. So that's a really positive thing that we in public health have been trying to work toward for 20 years, and Douglas County is beginning to chip away at the problem. So that's
Why
a
wouldn't the other
positive.
hospitals, I mean, why is it difficult to get everybody to agree to the same schedule? Because your point about bothering people for the same information is like really good, and I think what's going to happen is somebody's going to end up, people are just going to throw up their hands, and you're going to end up, getting people who aren't participating.
Well, I think that will come along. We had some early contact with the UC hospital, and they were interested in working with us, but then they have their own schedule with all of their hospitals, and that's part of it. These other ones are bigger chains locally, and they have their own thing going on already, and getting them to want to change their schedule. If they're only required to do it every 3 years and they just did it last year, they don't want to do it again this year just to play with us. Plus, hospitals are, just in case anybody didn't know, are highly competitive entities. So getting them to cooperate is a challenge and an accomplishment when it does happen.
Okay, thank you.
Let's see. COVID numbers have been relatively high in the country, but not off the charts here. Flu and RSV are still low. I looked at the curve the other day, and it's barely up off the 0 mark, so there's not a lot of respiratory stuff going on now. We still recommend that people get with their provider and see about vaccines as the best way to prevent any of these diseases. There's ongoing coverage. Last time we met, I talked about the bird flu in the northeast part of Colorado. That's still bubbling around the country. California has just found a human case, so it seems to have moved on from Colorado, but it's still out there, and no one knows what might become of that. And there's still news out there about the wastewater findings that were in Parker, and it's either that wild birds with bird flu flew over the settling ponds, or someone went to a place where they have this and bought raw milk and came back and then used the toilet and it got into the septic system. As far as the state is reporting to me, there's no commercial dairy operations in our county that would be, causing us to have a concern. There are some small cow share things going on, but no major commercial dairies. Let's see, future plans. I understand that very soon the commissioners may be voting on a possible lease for a new location for the health department, according to the county manager, so we'll see how that goes. And at the end of this month, I'll be going to the American Public Health Association meeting in Minneapolis. Vital Records continues to financially knock it out of the park. They took in almost $72,000 of the last quarter, and we initially started this, we projected the yearly revenue would be $60,000 from Vital Records. So we've really gone way above and beyond there. We discussed our applying for accreditation last time, and we did pay our initial fee, and we're beginning to work with the Public Health Accreditation Board to gather our documentation, and they would do a readiness assessment on you to see, are you really ready to jump into the deep end of the pool on this? They don't let you just throw out your application, pay all your big money, and then you can't do it. So we're in the process of doing that readiness assessment right now. And I think that's enough from me, unless you have questions.
Are there any questions?
I don't have any questions. Director Hill, thank you.
Thank you. Are there any questions on the written reports that were provided to us? I do not have any either.
So we'll be talking, let's see, the quarterly financial update, it is not an action item.
Correct.
I just wanted to point out, it looks like we're 75% through, we should have 25% left of the budget, and I think we have 28% of the budget left, which is a really good place to be. I would just like to point that out.
Okay, yes, it is. There are no questions on the written reports. Okay. Well, let us then move into the action items. And we will start with, and I was just talking to Commissioner Teal about this. We'll start with Director Hill. I'll turn it over to you.
Yeah, so I
you
just
can- You can walk us through these.
I put my name on this first one, but it's not me that had the request. There was a county commissioner request that the Board of Health provide input on the natural medicine, which is psilocybin is the major substance of concern here. A new state law is passed which allows this to be produced and sold, I guess, in counties with some enabling county legislation. And I mean, since two of the commissioners are on the board, maybe they could better explain than I what the question is that they're asking to the Board of Health.
Thank you. I'd be happy to discuss that. So there was a ballot question last year or the year before. Mr. Ted Trimpa was the political strategist who put it on the ballot, and it is to allow psilocybin to be used in healing centers in every county, and specifically it did not allow any counties to opt out of this legislation. So we have to do this. My concern is, as a state trooper, I was a certified drug recognition expert, and I arrested people who were under the influence of psilocybin. And they can be very dangerous because they are very much not in control of themselves. The other side of it is I have heard from people or a good friend of a person who had been dealing with sexual trauma from when she was a child for years. She'd been in therapy for years. After being with a doctor in Denver for 2 years, the doctor said, I think you could benefit from psilocybin. This person is someone who never doesn't drink, doesn't do any drugs. She thought about it and did it with the doctor's help, even though it's not legal yet. And the person who was treated told one of our staff members, actually, that for 3 hours it was a horrific experience. But after the entire event was completed, she is now able to deal with her past in a way she never has been. And if that in fact is true, then I think there might be a reason for this county to find a way to make this available, but through zoning. And that's why I wondered if the health department had any information besides what I have found on my own, just trying to find out about this. Because if it can make a difference, then perhaps that's the reason the law was put on the ballot. That's my concern.
So I'll go ahead and chime in, and I'm actually very critical of the enabling legislation. I'm very critical of this concept of psilocybin therapy. I do appreciate, Commissioner Thomas, you sharing that anecdotal testimony on this before us. I have not had that. I've had people pitch to me that, well, this is good for veterans who are experiencing PTSD. Well, I do know a lot of veterans. I don't know a veteran who has done psilocybin treatment in order to overcome PTSD. On the other hand, I know a lot of veterans who don't have severe PTSD in their lives. So I'm very, very doubtful of the effectiveness. And yet at the same time, like Commissioner Thomas pointed out, listen, we don't have the capability of opting out. This isn't like marijuana sales and marijuana dispensaries or facilities, marijuana bars, I guess they have some. We can't opt out like we did with cannabis. So we do have to make some kind of allowance. My plan would be, it would be very restrictive. I would want it to where, I'd want to restrict it through zoning to where there's only a few places in the county where it's even capable. I did have a conversation with my fellow director just before we got on, and Kim, you asked, do we have a lot of applications? We do have members of staff that do deal in any applications. Maybe they can enlighten the board, but I told her, to the best of my knowledge, we don't. I don't think we're having a big gold rush to try to come into the county. Steve Koster's coming forward, Mr. President, if it pleases the board. I think we should hear from Steve on any of that information. But my intent would be to make any psilocybin access treatment, again, I'm very doubtful. I'm happy to hear evidence of the effectiveness, but I remain very doubtful, and my inclination would be that it's very restricted in time, place, and manner here in Douglas County. But again, maybe Steve, if it pleases the board, Mr. President, perhaps Steve Koster with staff could fill us in on any applications we've actually received.
And Ms. Koster, just identify yourself for the record in your position, please.
Sure. So I'm Steve Koster. I'm the Assistant Director for Planning Services and Community Development. And the situation is exactly what Commissioner Teal said. We are in a position where the county can regulate the time, place, and manner of these activities. There are 4 different types of facilities. There are the care centers. There are facilities, licenses for facilities for it to be grown, licenses for testing, and licenses for processing them. So there's 4 different types of licensed locations. Those are being managed by the Department of Revenue. And then the Department of Regulatory Agencies is licensing the actual providers, the facilitators of the process. So we would be able to apply right now existing zoning regulations in the county to these types of facilities, just like we would any other kind of facility, because right now we don't have a special definition for the use. What we could do is define these as specific uses in our zoning resolutions and then identify zone districts where they would be appropriate, identify separation distances from other types of facilities. So the state regulations already require 1,000-foot separation of the care centers where people actually go for treatments from schools and childcare facilities. But the county could do more if it wanted to. It could do greater separations from those facilities, or it could require separation from additional types of facilities. Oftentimes we see for things like similar uses like this, separation distances required from churches or residential areas or parks, for example. So we haven't had any requests yet for these. I don't believe the state is in a position to actually issue the licenses. Once they are taking applications, they will be requiring that applicants bring provide a zoning verification from the local government that the location in which they're asking for this license is approved under zoning, so to speak, for the use.
So it was processing, treatment, growing, and what was the fourth?
Processing, treatment, laboratory testing.
Testing, okay, thank you.
Yeah.
I have one concern, sir, and that is the first medical rule, do no harm. Is there anything in that licensing requirement for the treatment centers that they have ready access to, say, an emergency room or to an advanced medical center? Because you're going to have reactions and you're going to have people having problems. And I don't want this out somewhere in the middle of unincorporated Douglas County where they need support.
Well, that is a part of the regulations that I'm not incredibly familiar with, but my general understanding is that there's not a lot of regulation in that realm in the current regulations.
Well, then I would suggest that we look at the sites very carefully and see what kind of support they could get. You've got to get an ambulance out there, you've got to get trained EMTs, you have a very bad reaction, you're going to be in trouble if there is no support service.
Commissioner Teal.
So, Steve, based on the regulatory capability and the enabling legislation for the county, we can regulate time, place, and manner in terms of our zoning. Do we have a zoning category for, as Dr. Fielding mentioned, advanced medical treatment areas, hospitals, emergency rooms? Do we have a zoning category that describes those medical facilities?
We have a few zone districts that would seem to match up with this type of use. So we have our commercial zone district, we have 2 different industrial zone districts. Usually those districts are located in our more northern urban area, so most of them would be in the South Metro Fire Rescue District. But there are locations where that zoning exists that are more remote, might be in, in a smaller volunteer fire district's service area or something like that. We would have to kind of understand what that impact is, if that's something the board wants to look at.
Commissioner.
Based on our understanding of the enabling legislation, could we, as a part of our zoning for these treatments, these care centers, could we require they be within a vicinity, a mile, 2 miles of an emergency room, a hospital with advanced medical treatment capabilities?
We haven't looked at that, actually. That's that's a great question. Typically, with zoning, you look at requiring minimum separations from things. So that would really be kind of taking the inverse of that. I looked to Chris Pratt, who counsels us a lot on land use things. Are you familiar with any precedent around actually requiring a minimum distance from something?
I'm not sure 100%. That is an unusual requirement. I would caution, we are by the legislation we cannot prohibit, and that would be the same thing as we must make sure that any regulations we have don't effectively prohibit by putting so many requirements and limitations on its use that there really is nowhere that it could be in the county. So I would caution that we would have to be careful that any regulations we do put aren't so strict they effectively prohibit it in the county. But I would say it's probably possible that we could have some kind of request. This body's request would be that the board consider that, and staff could then look into that in more detail and present that to the board.
Well, and I think, and this goes into the manner, because this was one of the questions that was sort of rattling through my head as we were talking about this. We understand time, we understand place. The question is manner. And this seems to be a manner question. And I would wager I would venture an opinion that that this board and the commissioners wouldn't run afoul of, concerns about effectively prohibiting these activities if it were a health concern. And what Dr. What you brought up is a health concern. You're going to have people who are potentially going to need medical care, going to need it quickly. And in fact, is it available? And I think Commissioner Teal's suggestion is a really good one. What immediately ran through my mind was, a requirement to have medical personnel on site, or a trained medical professional on site that could provide care in the event it was necessary. And it strikes me that would be, it would be consistent with ensuring that, you get good operators in here. So I guess as we're talking this through, I think one of the issues that we may want to flag and go to the commissioners with is, how are the facilities that are doing treatment going to ensure that they have either access to medical care or have medical care on site in the event it's necessary?
And I don't think the hospitals are going to restrict you too much. There are a lot of medical facilities in Douglas County. There's a lot of land and, a lot of places around that could be developed. So
Like over by Skyridge, for example.
yes,
Yeah.
there's lots of areas. And I just think the safety of a person is worth that.
Yes.
So I did a literature search on psilocybin, mainly because I work with ethics a lot, and so sometimes we have unusual cases that come up, and we have had cases of psilocybin at the hospitals. But one of the studies that seemed statistically significant as I reviewed it was in New England Journal of Medicine, called Single Dose Psilocybin for Treatment of Resistant Episodes of Major Depression. So there is some promising results with that. The psilocybin they're using, though, is like a manufactured. It's not like, here, take this mushroom. They're actually giving a small dose of psilocybin. It is monitored by someone with education of some type and training, and then they monitor them for roughly about a 4-hour period to make sure that they're safe to return. However, I don't know that that's necessarily how these clinics would operate, would be my first question, like what type of psilocybin do they have and where are they getting it? How do they measure purity? How do they know dosage? And how would that differ from, say, a dispensary? Because I think the biggest fear we have is around unrestricted use of psilocybin and people abusing it. So a lot of education, I think, would be needed.
Yeah, that a treatment center turns into a recreational use activity.
Or someone thought that their treatment was really effective, so therefore they're recommending it to others who then want to trial it without, because it is expensive. The treatments are expensive and the follow-up is expensive when you look at this type of treatment pattern. So therefore, just like, you know, marijuana could be legal here, but some other people that want to really abuse could go on the street and still buy it for less.
In reading the packet, it sounds like those governments that have already approved sites usually put it in light industrial or some kind of zoning such as a light industrial as opposed to a residential neighborhood. And I just want to put it here that Skyridge is in Lone Tree, and we are not recommending that it go in Lone Tree anywhere. I just want to make sure that's on the record.
Yes.
But if we were to consider something like along Highway 85, where there are light industrial areas, where there are no schools or daycare centers, then an ambulance could come from either South Metro or from Castle Rock and get to Castle Rock Adventist Hospital or even UC Health. But I really think that it's important to think about the type of zoning area. And Steve, doesn't the packet talk about light industrial areas?
Yes, especially for the growing, processing, and testing. For any other kind of substance or activity, we would really say that those should be limited already to our industrial zone districts only. So if our Board of County Commissioners ended up taking no action on this, our interpretation of the zoning regulations would be that those 3 of the 4 licensed facilities would need to stay in a light industrial or general industrial zone district only.
And would the healing center need to be there, or where do you think a healing center could end up?
You know, that's a little bit more open for discussion. I mean, it's been purported, we haven't really seen these yet, that they would be similar to a doctor's office or something along those lines. And our doctor's offices, our zone districts really just limit those to the commercial and business and light industrial areas. So we do have the ability for those offices to be in that same zone district, the light industrial zone district, and we do not have a lot of commercial or business zoning left in Douglas County, actually, because the municipalities have been annexing it up over the years to bring that into their areas. So light industrial practically is probably the most likely scenario for something like this.
But the healing facilities, you're right, are only one of the 4. The other 3, I think there are issues there. I think the way you described it makes sense to me how you would regulate it. The healing facility, I mean, I think you're right, the inclination, and I agree with what, we're not recommending any specific area. I agree with Commissioner Thomas. But I think the natural inclination for the healing center is going to want to go near other medical facilities. But how many like people, I mean, how many people come into these? Are they overnight facilities? How do they operate?
It's still a little unclear. They are, the way I understand the rules is that a patient would essentially be checking into one of these locations. There's no retail sale allowed under these licenses, so they have to be accommodated in the facility for the duration of their treatment.
Is this days, hours? What's the?
It appears that it could be hours, or even into a day or more, and the regulations require that these providers have administration session preparedness plans that they have to have procedures for escorting people to the restroom if they need to use the restroom while they're in there.
Or to make sure they don't leave the facility, right?
Yeah, yeah. So, and they are required to have an emergency plan, but the emergency plan is really limited to what will they do if their facility, if there's an emergency that requires evacuation of their facility. It's not an emergency of the patient, it's if there's a fire and somebody's in the middle of their treatment, how do you safely move them to a new location? That's the only thing I have found in the licensing related to any kind of emergency planning.
So Parker did put in their regulations 8 a.m. to 5 p.m. are the times that this center can be open. So a lot of them that I have seen restrict it to only that 8-hour period from 8 to 5.
Yeah,
I guess that's a
that
9-hour
seems to be what we're
period.
seeing in the local jurisdictions. We just received a referral from Arapahoe County of their proposed regulations, so we're digging into those now, also to see what it is that they're proposing.
So you can limit the facility time, which means you're limiting the nature of the treatment that they give. Okay.
That does disturb me a bit that you're going to be administering a psychoactive substance, and people don't fit into an identical mold. If somebody goes over that 8-hour, what do you do with them? That's a problem.
And these are questions that I think Dora and DOR are going to be wrestling with for a while, is how do they balance the local regulations and those, what they need to do for those centers. And
Is this unreasonable or illegal under the current regulations, that anybody wanting to open a treatment center has to at least have some type of an affiliation with a medical center?
that is not the kind of requirement that would typically be included in zoning.
I'm thinking
So-
about maybe you have some contact with Adventist or with Common Spirit or somebody, that if you get in trouble, at least you can refer patients.
And I think that's going to be, regulating that activity, that part of the activity is going to be left in the state's hands.
Okay.
The regulation, the legislation, and then the rules really narrowly allowed counties to regulate the types of things that are regulated in zoning.
Yeah, 'cause
And-
I am concerned about public health and want to make sure that, again, that we cause no harm with this, that we protect people who are trying to do this for the sake of getting better.
Director Hill.
So I'm wondering, Stephen, I didn't read this regulation. I'm glad you did on my behalf. But does it preempt us from putting any health regulations around this, such as what Dr. Fielding is suggesting, that you have some kind of a connection or plan to have access to medical providers?
Let me get to that part. And I haven't looked at the statute. I don't see anything in the regulations that allow local health departments, but let me look up. I do remember that there was something about public health orders.
Yeah.
Thought I did, sorry about that. Chris Pratt with the County Attorney's Office. I could add, there's a provision in the statute that says a local jurisdiction, in the county, shall not prohibit a facilitator from providing natural medicine services within its boundaries if the individual is licensed facilitator pursuant to this article. And I think that's where we might get into trouble if the state says that they don't have to have medical people on site, and we say they can't provide it if they don't. We might run afoul of that prohibition on us. That's where we kind of have to stay in our lane of, we can do land use issues. That's our purview. But we need to be careful not to step into what we think the state should be telling them what they need to do to have a license.
What does manner mean then? Explain manner.
Well, manner can mean, I don't know if we can get into a legal discussion on that, but manner, we can put some requirements on manner. I'm not trying to imply that we can't. I'm just saying we have to be careful. This particular enabling legislation specifically prohibits us from telling someone who is licensed that they can't provide the service. Now, that doesn't say we can't tell them they must locate their facility in a specific location, perhaps within a certain distance of a medical facility, unless that could be, we could have a provision maybe that waived that if they had medical people on site that could treat. I mean, there's ways we could try and work some of this in. We just have to be careful not to paint with a broad brush.
Well, I think it's going to depend upon the reasonableness of what we require. If we say you have to have 3 board-trained doctors on staff all the time, everybody's going to see through that and say, you can't play that game, and they would be right. If you say, as you just pointed out, okay, you have to be within X distance of a hospital, and you have to, inform the hospital that you're there and the nature of your business. And if you don't meet that requirement, then you have to have some medical personnel on site or at least available in the event of an emergency. Available as in like immediately available. They can be there really quickly. And I'm a little shaky on that one because that strikes me as a big loophole. But I mean, so manner could mean that, manner could mean public health protection and putting reasonable restrictions around operations to ensure that people that are taking this, and I have no opinion on the efficacy of this. I just don't know. That you can make public, you can put in public health requirements. Would you agree with that?
I would, and Steve, correct me if I'm wrong, but there are layers to the land use process. We do things with, for instance, a use by special review, where we could make sure that any new facility that wanted to open had to, we would have to give notice to the nearest hospitals or medical provider nearby. That's something we can put in our regs if I believe would be possible for us to do
I
something
think
like
we
that.
could, yes.
And a use by special review they would then have to tell us how they're going to operate that business there. We could talk about times of operation, those kinds of things in that process.
Yeah, and as we said, time sort of dictates the nature of the treatment, it sounds like, as well. And I don't know if that's a good thing or a bad thing, but I mean, even if you were to bifurcate it and say, certain places maybe you can't have people spending the night, and certain places that, maybe more remote, and maybe you do. I don't know. I'm wandering here a little bit. But at a minimum, it sounds like what I'm trying to do is get the sense of the board. But I think the sense of the board, to me, appears to be that there should be a further examination on the on treatment available in the event of a medical incident at facilities, and that treatment, and that the commission may want to look at whether it's it's appropriate to whether the manner of operation that the county would allow should have guardrails for available medical treatment. I kind of butchered that. If I didn't get that right, let me know. But
Yeah, I just basically want a medical safety net for this.
yeah, that's much better put. Yes, Commissioner.
I really like the suggestion made by council of implementing a use by special review provision. Reading through the packet, we see that Parker and Castle Rock have already taken Parker has taken action in how they define the healing centers in business district and commercial zone districts, and then cultivation, manufacturing, testing in light industrial zone. Castle Rock has one reading of the ordinance that will enable this. That's very similar to Parker. And then you guys probably are not as familiar with the Castle Rock zoning districts as I am. I know where those are, so that makes sense in terms of what Castle Rock and Parker are doing with their zoning. But then I really like the idea put forward by the council of the use by special review provisions. So then we can stay by limiting healing centers to our commercial areas with a vicinity requirement to medical treatment facilities. The other three categories, limiting those to light industrial, but in every case, having a use by special review provision, so that it does come before the board in a public meeting. There is correct me if I'm wrong, Steve, there's a referral process for neighboring businesses, residents.
Yes, there would be a referral process where we would notify regulatory and advisory agencies, and we would require at least a notice to adjacent property owners. It's possible that for specific uses by special review, we can have we could look at additional noticing requirements beyond kind of the baseline.
And then, so I think we should have the use by special review provision in the commercial light industrial for the facilities in the commercial areas for the treatment facilities within vicinity to medical treatment. But then more important than anything, both Castle Rock and Parker adopted a 1,000-foot distance requirement from residential areas. I mean, we have our two largest municipalities in the county doing that. I think we can mirror that very easily, and we'll probably address a lot of the concerns like from people like me who are out there by having those elements in any zoning. I mean, Mr. President, I'd ask, if the board thinks those are reasonable as well.
I certainly think that, and you're talking about the health centers, and you're not talking about the processing.
Yeah.
Because that's the processing centers, because that's going to be a different animal, because, there's going to be chemical use there, they're going to be subject, and this is one of the things you want to look at, they're going to be subject to a bunch of environmental laws that should provide some protection. If they are not, because they fall below a certain threshold, then you just want to make certain that, they're informing the fire department of what they have, and they're managing chemicals that they use appropriately, so they don't get into the environment.
And again, our use by special review provisions, we could probably address that part for the processing. But in every one of these, I would suggest to the board, it would be reasonable for us to go with our two largest municipalities and require 1,000-foot separation from any residential areas for all classes.
I agree. Or more. I think on the processing, you're going to want more, but I will leave that up to you. I think that's an excellent idea. I think use by special review is an excellent idea. And I think the 1,000-foot requirement, particularly for the health centers, is a good idea. And the other ones I think you want to take a look at. The lab and the processing are just going to be more, they're going to be chemical facilities. You want to just be aware of what's going on over there and, how close they get to residential facilities. But I think your suggestion is an excellent one. Are you looking for the board to do something official?
I would defer to our Board of County Commissioner members who are here. I don't think we're required to take any formal action. It may be enough that staff is here and has heard the input. I would defer to the board.
But are you looking
what
for
they're
something like resolution-like from the Board of Health to the commissioners in a more formal way, so you have it, or?
When that was brought up at discussion before the board, Mr. President, it was Commissioner Layden who suggested getting the input from the Board of Health. I agreed. Commissioner Thomas, I think you agreed as well, that was the way to go. But let's go to, it was suggested by Commissioner Layden. Commissioner Layden has also introduced requests for advice from the Water Commission. And in those, the criteria was not a formal resolution at all, but really soliciting the opinions of the board, or a board opinion. No vote was mandated before the Water Commission in the instances where it was solicited. And really it was presented back to the Board of Commissioners in the case of those Water Commission requests for opinion, really through notes from staff.
Okay.
So if, I guess, if staff feels confident that they have heard the board and have solicited kind of the opinion of the board, that might be enough.
Well, in order to make sure that we have that, then, Mr. Coster, why don't you repeat back what you have heard the board say, and then we can make sure, you didn't realize there was going to be a test, did you? But tell us what you heard, and that way, that we can just make sure the board's all on the same page, so later on somebody doesn't say, well, wait a minute, that's not what I meant, or,
So,
Or
sure.
do you want me to repeat what I heard, and then you can, is it easier for you if I do that?
I can.
Oh, okay.
I can give it a whirl.
Okay.
So what I heard was at minimum 1,000-foot separation of any of the licensed facilities from residential areas. But with possibly looking at more distance requirements from some of them, and that would require more research. I heard that a use by special review should be required for any one of these types of locations. And I heard that only the health centers, the treatment centers would be in the commercial, would be possible in a commercial area. And the other three would be limited to an industrial area. And I heard that there should be enhanced noticing requirements to health providers. So identify like a nearby hospital that patients would be going to, making sure they're aware of this facility being located in their vicinity. I feel like there was one more thing.
And I think just a close look at Castle Rock and Parker's resolutions, because I think what you had suggested is taking a look at those and perhaps even mirroring, to the extent that you all agree, those provisions. And I think time of operation is, because that I think they captured time of operation as well, which I think would certainly define the nature of at least the healing facilities that you would get in the county. Anyway, yes, Commissioner Teal.
And then the one of the things that was talked about and brought up by Dr. Fielding was a minimum distance from, a requirement for a minimal vicinity from a medical treatment center as well, if it pleases the board.
Now, they have to be within a radius that they can get somebody there if there's a problem.
But we have to be sure that that's not eliminating the ability for anyone to open a center as well.
And if I may, just this may help with that requirement. Would this board be okay if there were some sort of waiver or exception to that if there were medical people on site?
Yes.
Yeah.
And I do want to ask council one other question. Okay, so we approve one of these facilities, and I assume that will be done at the commissioner level, not the Board of Health. Who gets sued if somebody dies?
That would be very circumstance specific,
They have a
but
bad
the
reaction,
county and
you can't
the,
get somebody there, and it's a typical, okay, If we had had somebody that was trained, maybe they would have survived. You know, all those things that go into malpractice. Who will get sued if somebody dies?
Most likely the facility and any medical provider who participated in whatever happened.
County have liability.
It seems unlikely.
I'd just like to say on the record that I'm not sure Castle Rock has passed something. Do you know if they have, Steve?
I don't believe they have, but we'll stay tuned into that.
Yeah, it's in the packet, Commissioner. First reading, they've gone through first reading. Second reading on the proposed ordinance, well, it's scheduled for August 20th, so I guess we don't know if they've actually passed that second
So the
reading.
news articles indicate that it has been postponed.
Yes, that August 20th second reading, they did not take the final action.
Yes, I've talked to council people. That's why I think it has not been finalized, but just for the record that they're talking about it, but they haven't decided yet.
Okay. Have we fulfilled our obligation here?
I think we have.
Okay, excellent. Director Hill, move us on to the next item.
Okay, next item's a little more straightforward. The county is having some kind of an event on December 12th in the evening and requested that we reschedule that meeting. And I'm suggesting December 5th as the replacement for the December 12th meeting. So we would just need a motion and a vote from the board on that.
Let everybody check their schedules.
Yeah, Mr. President, the Board of County Commissioners will be having our State of the County presentation to the community the evening of December 10th. So if it pleases the board, I do have a motion to reschedule the next regular Board of Health meeting to December 5th at 5 p.m.
I'll second that, but make sure everybody is available.
Are there any conflicts with that? Sorry, I'm sure there's not for me, but,
I have no conflict.
I have no conflict.
okay. 5th is a Thursday. Okay, yeah, that's good with me. So we have a motion and a second to reschedule our December 12th meeting to December 5th. All in favor, say aye.
Aye.
Opposed? The motion passes. And I need to go back because we did not look for public, we did not solicit public comment on the natural medicines issue we just discussed. So let's go back to that, and then we'll do public comment on the moving the meeting. But is there anybody in the audience want to comment on the discussion on Board of Health opinion on natural medicines? Please, name and town in which you live in, please.
John Fielding, Finery. I have a question actually for council, if the board will allow me to ask it. And that is this psilocybin stuff still illegal under federal law? And if so, do we have a complication because of the supremacy clause in the Constitution that says that generally state statutes cannot trump federal law? Thank you.
Why don't we do this? Let's sit on that question. You heard what it was. Let's get to the end of our agenda, and then we'll come back to you to answer that question. I mainly want to give you the opportunity to think about it before I put you on the spot and say, please answer that question. Next, is there any public comment on moving our meeting? Thank you. Does anybody online have comment? I
No
should have
comment,
asked.
Mr. President.
Okay, thank you. Okay, now we're caught up. Director Hill, let us move to review and approve or not funding allocations from the state received since the July Finance Committee meeting.
Yes, sir. So I'm not going to read through each one of these unless you ask me to, but we've got about $1.5 million worth of funding we've received documentation on from the state since your Finance Committee met in July, and we're ready to ask you to accept that on behalf of the county.
Just broadly describe the nature of the funding, please.
So the biggest part is the WIC program, and we talked to you last time about us asking for extra money in that program to expand and work with Northeast Colorado Health Department. So WIC is $500,000. That's a contract that went into effect the day before yesterday, technically, but with moving the board meeting, we're accepting it kind of a little bit late. What else is noteworthy in here? The rest are mostly little things, 10,000, 20,000.
It's in everybody, yeah, it's in everybody's packet, but I just want for the record to just have on the record what it is that we were talking about.
And then a fair amount of it is the funding for the Early Childhood Council, which
Right.
came in a little later than the Public Health Department got their funding out. So there's several grants because they don't give it in one big package. They give her many little buckets of money to deal with.
Okay. Is there any board discussion on this?
I don't have any.
No? Is there any public comment on this? Is there any comment online?
No, Mr. President.
I would accept a motion to, let me read this. I would accept a motion to approve funding allocation from the state received since the July Finance Committee meeting.
So moved.
Second, please.
Second.
We have a motion from Commissioner Teal and a second. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Let us move on to Chris Burnett, a request to approve 2024 strategic plan. If you just identify yourself and your capacity with the county for the record, I'd appreciate it.
Sure. Hi, my name is Chris Burnett. I'm with the Health Department. I'm in quality improvement. Last year in July, we brought the board the first strategic plan, which was a meeting of stakeholders throughout the county getting together to put together the plan. Starting this June, we did our one-year review. Basically, what that entailed is we had each department within the health department, I had a meeting with them and went over what the strategic plan was and had them point out issues or anything that they felt like there were changes, or we update the strategic plan quarterly from a results standpoint, and anything that they felt like the timelines weren't right or anything. So before, in your packet, you should have a copy of the suggested changes. After we got those changes, we met with the original members of the strategic planning committee and some additional members because we had some people who were not on that committee at the first point. And so they agreed that the changes were in line with what they felt the Board of Health, or not the Board of Health, but what the Health Department was looking for. And then Director Hill and I also went over it and made sure it was in line with what the goals of the Health Department for the next 2 years or so. So we're asking you to approve the strategic plan as we made the updates and changes.
Okay. What worked and what didn't?
A lot of
give
things
us an
worked-
update on it.
Yeah, sure. A lot of things worked really well. A lot of the changes we had were in the SWOT analysis of the strengths and weaknesses. A lot of things that we identified as a weakness or an opportunity, like the school board was one example. We felt like we've made a lot of progress with working with the school board, so that didn't move to a weakness. There was also a few like technical wording issues. There was some talk about that we were going to only focus on chronic diseases. We really want to focus on any aspects of public health, so we changed the wording on some of that. There is an initiative that Laura and her team are working with the Sheriff's Office that's going to be coming forward. She wanted to shift some of the focus in some of the behavioral health area to a suicide prevention thing that will be down the road in conjunction with the Sheriff's Office. So they wanted to shift our strategic plan to focus more on that partnership and what that'll look like. And then just a few, subtle changes. But mostly it was trying to get aligned with where we currently are. I mean, as this board knows, the health department wasn't around when we first did the community health assessment and the community needs assessment, or the community improvement plan. So it wanted to get where some of that was more tailored, because the strategic plan is really based off that. I would expect that with the due community needs assessment and the public health improvement plan that'll come with that, we'll redo the strategic plan to get more in line with what that is. But based on what we had, we wanted to make some changes to really focus on where the direction of the health department it has been and where we were planning to go.
Okay. Thank you. Director Hill, do you have any?
No, I think as Chris said, these are relatively minor changes. And in the strengths, opportunities, one of the weaknesses we noted was that we're a brand-new health department. Well, we're over that now, so we took that part out. So just kind of cleaning it up. And I think as time goes by, these strategic plans will dial in their accuracy and we'll be less likely to come to you every year trying to tweak it.
Though, coming to update is a good thing, because, this is the guiding plan. This is like, okay, what, and again, my question, what's working, what's not, is a fundamental question, I think, that you're going to get every time this comes up. Are you guys identifying, where you're having successes and where you're falling behind, and, how you're going to duplicate the successes, and how are you going to remedy the falling behind?
Well, sure, and we changed some of the timelines because as we were setting these goals for ourselves, these were things we hadn't done before, so we kind of misjudged how long it would take to accomplish some things. So we're making, adding some more realism to it each time. So I'm not saying we won't bring you updates, but I think it's going to be more refining each time and less changing of languages and changing the nature of our environment.
Well, and I think staff turnover is going to continue to be an issue as well. The nature of the organization, I think that you note in the plan the flat structure of the organization, which doesn't leave a lot of room for people to sort of move into something else. And I think moving forward, that you're going to have to be creative with respect to staff retention, because I think it's important.
Agreed.
I'm sorry, not to interrupt, but I would say that one thing that is not reflected in this plan is in the past year, we've had 11 people move into different roles based on what they'd like and moving into more of a supervisory role. So on a staff of 43, that's 25% of our staff has had opportunity for advancement in other larger areas, which is a fairly high rate. Most of those positions have been into a supervisory role. Some people have wanted to move, like we had one of our vital records clerk who became a grant accountant, which is obviously, an opportunity for her. We had one of the environmental health team want to move from the protection side to the water side because that was more of an interest in what it was. So there is some opportunity there. And part of our workforce development plan that we worked on is trying to identify what the other opportunities are that we can do. We're not going to make the health department larger, and the salaries aren't going to go astronomical, but how do we train people from a professional standpoint? So if you look at the number of people we've sent to like conferences and things like that, we've sent just this year probably 15 or 20 people to national conferences. We had, I think, 8 people at Public Health in the Rockies just this week. So the idea was to give people lots of opportunity from a professional growth standpoint, not just I'm an epidemiologist, so I'm only going to go to an epidemiologist thing. If they're interested in a more broad health picture thing, they've gone to other conferences. So we're trying to offset a flat structure to how do we get people professional or personal growth. There's a couple of people who've gone to managing up, like how to manage your manager and things like that. So there's been opportunity for people to come to us, and as far as I know, no one's really been told no, of, hey, what else do you want to learn about, or what else can we do to try to get that, to somewhat offset that.
Excellent, thank you. So are there any questions from the board?
I don't have any, thank you. When I went through this, I thought it was well thought out, and this really hits the mark of what I thought of when I made the motion to leave Tri-County Health in July of 2020, that we wanted to be small enough to be fiscally responsible, but big enough and organized in a way that the public health needs of our county and our residents could be met. And I feel like that's being accomplished, so thank you.
Well, and I would also just mention that the community health team has done an amazing job. We went from very few events. Right now, last year we had, I think it was 85 events for the year. We've already been in the community for 93 events as of the first 3 quarters. And our contact list went from a very small amount under Tri-County to, I think it's 88 or 100 different organizations that we're partnered with throughout the county. That's all very Douglas County centered. So it's really been able to, they've identified a lot of partners and are really working towards the needs of the county.
I think that's important. I got an email 2 weeks ago from someone still railing about our horrible decision to leave Tri-County Health. And I always answer those with, please tell me what services you want that we are not providing. And I never get a response back. And it's like, if Tri-County was so great, how come Arapahoe and Adams did their own as well? I mean, there's a long discussion here, but I just really think that you are reaching out to our citizens and accomplishing what we need. And I want to extend the thanks from me as one county commissioner to all of you who have made this happen.
Any other comments?
I want to thank you for the positive notes there. And there are a few things that we're already doing better than Tri-County, but I think we could do better still for Douglas County. So we've got a few irons in the fire that I'm not going to expose in public yet, but things are going to get even better next year.
Wonderful.
Thank you. Commissioner Teal.
Well, and, Director Hill, one of the weaknesses I noticed in the SWOT analysis was added was the multiple locations, and pretty sure we're going to get that solved here pretty quick.
I think we have some friends who could make that happen.
And actually, I will say one thing, Director Hill. We started from zero. We started from absolutely nothing. And so to have accomplished what you've done, you certainly deserve my thanks, the thanks of Douglas County, and the thanks of our commissioners here, as you've heard. And so, keep up the good work. Thank you for yours.
Thank you.
I would accept a motion to adopt the revised strategic plan.
I have a motion to approve the Douglas County Health Department Strategic Plan 2024 update.
Do I have a second? I have a motion and a second. All in favor? Oh, wait. I need to do public comment. My apologies. Is there any comment from the public? Anybody online? All right. We have a motion, and let's do a motion in a second again. You would read.
I have a motion to approve the Douglas County Health Department Strategic Plan 2024 update.
Okay, I will second that.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Thank you. Director Hill, back to you to request approval to create a lead public health clerk.
Yes, sir. Thank you. So with the growth of revenue and staff in our vital records area, we'd like to create another promotional opportunity for kind of a lead clerk in that area. Not a supervisor, won't hire and fire, but just kind of to coordinate efforts and coordinate the training of new staff as they come in and kind of keep things together from our clerical perspective. And at the same time, as we discussed earlier, we're doing this cooperation with Northeast Colorado Health District Health Department, and that requires us to have an additional dietitian, which is funded in the $500,000 item that was included in the previous item there for WIC. So I don't see a downside. We're creeping up our FTEs by one, but it's fully funded by the state, and I don't feel too bad about that.
And it seems to be important, necessary.
Yes, sir.
Any discussion from the board?
I'm inclined to approve just because in terms of the dietitian, we know, as Director Hill just mentioned, it is covered by the state with our partnership in the Northeast Colorado Health Department. And then the lead public health clerk, again, this kind of goes back to the discussion we've had a number of times, and we just had it we just heard it in our strategic plan of giving opportunities for people who excel to advance. Given where we are with our cash flow, with the records, I think it's reasonable. We're not trying. The revenue is staying in the revenue producing area. So, I mean, that would be a reasonable business decision for a lot of businesses. I think the people of Douglas County expect our government to operate like a business, not like a bloated government. So, I don't know. I'm inclined to support both requests.
Is there any public comment on this item? Is there any comment online?
No public comment, Mr. President.
Well, I agree with Commissioner Teal. One, I think the positions are necessary. I think there's a defense that's been made of them. Certainly in the packet there were, and I not only would support them, I would heartily support them. So I would accept a motion and a second.
Okay, I'll make a motion here. I would move that we accept the request to create a lead public health clerk title and to add a registered dietitian position.
I'll second that. Oh, sorry. Go ahead. Oh, go ahead, you second.
I'll second.
We have a motion and a second.
I would just like to
Oh,
add a
yes,
comment.
please.
Now that citizen comment is over, I'd just like to put on the record that I do support both of these. I've had to use the services of our Vital Records Department. And is Tabitha still there? Is it Tabitha?
She's the one that got promoted to an accountant.
Okay, I just want to tell you that I had to use our vital statistics office to get some death certificates, and it was a complicated situation, but they were so helpful to me. They weren't the typical government that said, you know what, we can't help you, go away, so I had to keep going back in line. They said, give us your name and phone number, and when that shows up, we will call you. And that kind of customer service is what I want our health department to continue to demonstrate to everybody who needs to do that. And so in light of that, my personal experience with these people, I support this. And the fact that you have found a way to partner with a rural group of counties, and having been in CCI, that's the County Commissioner Organization statewide, our rural counties really struggle. And that's why I really appreciate, Mike, you working with them and getting this done and getting another dietitian to help those other communities that are struggling. So I support both of these.
Thank you. We have a motion, we have a second. All in favor, say aye.
Aye.
Aye. Opposed? Excellent. Now let's move on to the last item, a review and approval of the proposed budget for 2025. Director Hill, give us the briefing.
Yes, sir. This is either a proposed budget or an eye test, as you wish to call it, but it's pretty much just an incremental budget from the current year, which was incremental from the previous year. It takes into account all the revenues that you've approved since last year, including some that you approved tonight, and then just allocates out the existing staff plus the additional registered dietitian based on that.
What's the growth rate? So what's the growth rate year over year?
It's roughly, if you take out this additional dietitian, which I can't compute on the fly because
That's
it's
fine.
too late in the day, we got about a 4% increase in salaries last year, and there's been a few little tweaks to the salary chart by the HR director, but around 4%, I would say.
So almost probably inflation, maybe a little bit less even.
Yeah, probably around inflation
Yeah.
rate. Yeah, pretty
Okay.
close.
So basically, it's a flat budget.
Yeah, and there's no big ticket items in here that we're asking for. And even like Chris mentioned, we sent a lot of people to national conferences. Well, last year I secured a federal grant to pay for that. So it's not that the taxpayers of Douglas County are sending those people. It's the federal grant is covering most of that.
Yeah, and they're worthwhile conferences, nonetheless.
And they're
Yes.
worthwhile, and people are enjoying them. Mariella, who's online, got to go to Detroit to a national conference.
And that information, they bring back information too that helps us run our health department better. Because, a lot of people, I've been in your shoes, a lot of people criticize conferences, but, the right conference and the right people there can really benefit their job,
Absolutely.
their performance.
So last month, I was at a 10-county budget conference. This is a conference where the commissioners and staff from the biggest 10 counties in the state get together, excluding Denver, to talk about their budgets and what they're looking at for next year. And a majority of them talked about salary increases next year, for even a little bit higher. I know, I don't think we were looking at that kind of raise, but when other counties are doing that, if we don't keep up with them, then we lose good staff. So my point in all of this is I think 4% is a good target, Mike.
Is there any public comment on the budget? Do we have any comment online?
No comments online, Mr. President.
Do we have any additional board discussion on this matter before I call for a motion? I call for a motion to, a motion and a second.
I'll make a motion to approve the proposed Douglas County Health Department 2025 budget.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? Thank you. So we had a question that was posed to the board's attorney. I'm going to now go over to you, Mr. Pratt, to see if you can briefly provide an explanation.
Well, the best I can do for you is to confirm that, if I'm going to pronounce this correctly, psilocybin?
Psilocybin.
Psilocybin is a Schedule I drug. Natural medicine includes more than just psilocybin. It includes psilocine, dimethyltryptamine, ibogaine, and mescaline, all of which, as far as I can tell, are all Schedule I drugs, which under federal rules may not be prescribed, dispensed, or administered. This puts those seeking this ability with the state in the same situation as marijuana. And so I would say that to anyone interested in what the potential conflict is there, they should look at what has happened with marijuana and how that has kind of worked its way through the system and what's being done. There are some risks potentially to people who would try to operate such a business, and they need to be aware of that, but it's not something necessarily for the health board.
Right, nor the county, do I think, because you're right. This happened with, when I was at the health department with medical marijuana, and we were administering a medical marijuana program, and there wasn't a risk to us, though there were several people that did get arrested, that had federal agents. I think it was DEA that came in and initiated enforcement. So yeah, we were not at risk at the state health department, though practitioners, I believe, could be at risk. Though the risk is probably pretty small at this point. But I'm not providing a legal opinion. I'm just
Correct. Correct. The county will not be prescribing, dispensing, or administering.
Correct.
And
And we are.
substances.
risk would be small, but it means that it's going to be very difficult to get a physician, a licensed physician, on site at one of these treatment centers, because potentially, if they hold a DEA license, and most people do, that is at risk when they go to renew it. So they are violating federal law. You may be able to have a notification to an emergency room that in case, a hotline number, if we have a problem to get a patient over there, that probably, but you will not have cooperation with say, any of the large Adventist or Common Spirit, because they want to be in compliance with federal law. And even with the university, when I worked at Denver Health, we were not allowed to prescribe marijuana or to deal with that. And if they did any research at the U, people brought in their own doses. So this will be an issue.
And it puts lawyers and banks in an interesting position also. Commissioner Thomas.
Thank you. I misread the motions log. I thought that we were going to approve each one of these grants. So I had questions about some of them when I read it earlier today. That the contract period, for example, the Early Childhood Council is from July 1st of 23 to June 30th of 24. So how come we're doing this when these dates are passed?
So they're a fun organization.
Oh,
So what they do is they each year allocate out a little piece of that money that's meant to go for 4 or 5 years. So last year we got a piece of it, this year we're getting a piece of it, and we can provide further backup documentation if you want, the contracts, but the contract reads like this whole bunch of different lines of different amounts of money, and then there's one little highlight that this is the portion that's for 2025, for state fiscal 2025.
Okay, that's good, because there were 3 like that, and there was one with a funding period of August 24 to September of 24. And that's OPHP Preventative Block Grant Rapid Funding.
Yes, that's something we applied on a Wednesday, we got approved on a Thursday, we've spent the money already.
Okay. I just saw those dates, and since they were in the rearview mirror, I thought, are these typos, or how come? So thank you for the explanation. That makes sense. I have no other questions.
And some of these would have been making more sense, a couple of them, if we'd met when we were scheduled to in September, because then it would have been before, but life happens, and here we are now.
10 county budget, where we learned about budgets. That's where I was. So thank you for that explanation. I appreciate it.
Thank you. With that, I will move to general citizen comments. Do we please identify yourself and the town you live in?
With all due respect to Mr. Hill, whose job I generally support, I respectfully submit that this board's decision at the last minute, or at the last meeting, to approve accreditation is a Trojan horse. It is a danger to your control over the health department, because what these accrediting agencies do is they take the current prevailing professional groupthink and they make professional standards out of it, and then they enforce those standards on their members. If this board, I repeat, if this board had tried to do what it did with COVID and there was an accrediting agency involved, that agency would have been fighting you every single step of the way. The thing that you really have to avoid is entering into contracts with third parties that require our health department to be accredited and in good standing. Because to the extent that you do that, you are surrendering your ability to control the health department and the health department's ability to respond to the desires of our citizens, and not to unelected bureaucrats who are staffers of these accrediting bodies. Because if you adopt such a contract, you'll have Mr. Hill telling you, or Mr. Pratt telling you, that if you don't toe the line of what these accrediting agencies want, you'll be in breach of contract. You could have, the county could be exposed to legal liability. And so I think this is a very dangerous thing. And I want to advise the board of my concerns. Thank you.
Thank you, Mr. Fielding. Is there any additional board discussion? Then I would entertain a motion to adjourn in a second.
So moved.
Second.
All in favor?
Aye.
Aye. Opposed? Thank you all very much.